Good morning, and thank you for joining today's call on hunger and health. Our call will be led by a panel of hunger and health experts who work to spotlight the overlap of their work every day. I'm Elizabeth Cooper with Second Harvest Heartland, and I'll be kicking off this morning's call with a quick minute of housekeeping. First, please note that everyone except our speakers will be muted during the call. That said, we'd love to hear from you and incorporate your questions as time allows. So you can post questions in the chat, on Facebook, or feel free to email me directly at ecooper@twoharvest.org. If you'd like to record the conversation, we welcome that. Please just click the request button and our team will give you access. I'm going to pause for a few seconds so we can receive and process those requests. Okay, thank you so much. And with that, I'm pleased to introduce the amazing Jana Martin, Second Harvest Heartland's FOODRx product manager and our food bank's registered dietitian. Jana, please take it away.
Thank you, Elizabeth. Good morning. So here's what I noticed when I visited the doctor for my annual checkup. I've always been asked if I'm eating right, but I've never been asked the big critical question behind the question, if I can afford and access the healthy nutrition that my physician actually wants on my plate. This disconnect has been too prevalent for too long, and it's costing us. Not surprisingly, chronic disease among hungry people is significantly more prevalent than it is within the general population. Fully a third of food shelf clients live with diabetes, nearly half live with high blood pressure, and all told, hunger costs Minnesota nearly $550 million in unnecessary health costs each year. Many food bankers and medical professionals are acknowledging that interconnected nature of their work and are increasingly talking to one another. FOODRx prescription boxes are one common sense solution we've come together. The idea is to leverage the power of food banks, the expert food movers, and healthcare systems, the expert disease treaters, to deliver healing food to patients living with chronic disease. The prescription food boxes contain culturally connected food that's tailored to meet each person's healthy needs. We educate folks on how to manage their diabetes and other conditions through nutrition and provide recipes so people can cook up the food that they receive and enjoy it. It doesn't just feel good, but it works. FOODRx makes people healthier. We spent seven years testing different ways to integrate food security solutions into healthcare settings. The FOODRx boxes present an easy way for healthcare teams to connect their patients to nutritious food and education. The boxes lower the cost of treating patients and improve their health. In fact, the price tag is closer to what we would expect at the farmer's market versus the pharmacy. So let's dig in to discuss what bridging the gaps between healthcare and hunger fighting can mean for Minnesota. Now, I'd like to introduce my fellow panelists. Rose Robinson, who is a chronic care coordinator at the U of M Physician Broadway Family Medicine Clinic. Michael Koch, a program manager in North Memorial Health's ACO and Network Management Division. And finally, Fred Naaktgeboren, the executive director of the Buffalo Food Shelf. Thanks for being here, everybody. Shall we begin? So first, Michael, given that North Care Collaborative was our first program partner, and North Memorial Health has implemented FOODRx in all 13 of their clinics, can you explain in more detail how FOODRx works?
Certainly, and thank you for having us today. Well, first off, you gave a great explanation of how the FOODRx box works and kind of the general idea on why we partner with Second Harvest. We know that providing some stability from food insecurity can allow our customers to focus on other aspects of their life and really focus on knocking out some of those other socioeconomic determinants of health. We've been working with Second Harvest Heartland for coming up on 4 years now, with the goal of providing assistance to those struggling with food security by utilizing the supplemental food boxes through the FOODRx program. To reiterate what you said, the FOODRx program provides beneficiaries a 30-pound box of food, of shelf-stable food, let's clarify, once a month to beneficiaries who screen positive for food insecurity. Additionally, from the healthcare side of things, we also are looking for ways to improve their health while giving them a stability with food. And so we also screen for one of 4 chronic conditions as well, those being ischemic heart disease, CHF, diabetes, or hypertension. The program with us runs 6 months, and we enroll those beneficiaries or customers for that 6-month time period with the hope that we can provide that stability and help them graduate from needing those FOODRx boxes at the end of that 6-month period.
Excellent. Thank you very much. On to Rose. Rose, your team has always been game to work with us on all new innovations for the program. Can you share a bit of some of these pilots and results that you've seen?
Oh, sorry. Yes. Thank you for having me. So yeah, right now we're working on the fresh produce pilot along with the FOODRx program. So the pilot right now is for 20 patients. And I think this will go along good with the FOODRx. And I think that it is very healthy for patients. I decided to do some measurements. So only on the patients that completed the 6-month program. So at the beginning of the 6 months, I checked to see what their blood pressure was, what their A1C was, if they were diabetic, and what their weight was. And at the end of that 6 month, it was like a great difference. It made a great difference in their health. Their blood pressure went down, A1C improved, weight went down. So the fresh produce pilot combined with the FOODRx, I think is a great benefit and healthy for patients.
Excellent, thank you. And now Fred, the Buffalo Food Shelf signed on to be a FOODRx wellness partner right as the pandemic hit in spring of 2020. I believe we signed the contract the end of March.
Correct.
Yes, can you explain what it means to be a wellness partner and how you've adapted to serve folks over this last year at the Buffalo Food Shelf?
Yes, thank you for the opportunity. One of the things that is kind of our philosophy at the food shelf is we never want to miss a chance to expand what we do. And when we went into the original recession in 2009 and 10 and so on, we grew so rapidly we didn't believe we could keep up. So interesting enough, for a number of food shelves out here in the more rural parts of Minnesota, we have not seen the dramatic increase in client usage that the metro area has. And one of the things we've done to help us out on that, when we have extra produce, we have some contacts within the metro area that we bring food to. But the key there again is increasing the outreach, because the food insecure community is always out there, and they're hard to find. There still seems to be, to me, a stigma of coming in and telling someone your name and your family situation as far as income and so on and so forth. So people tend to avoid that, I think. So when we had the opportunity to join with FOODRx, we just thought that was another avenue to reach into the community to help the food insecure. We, as we said, we joined right when things were supposed to shut down. And one of the things we didn't do was we didn't stop client choice. We just changed the style of it. For those of you unfamiliar, client choice is the client picks out their food. What we did in the pandemic then, or as it began, is instead of having people in the waiting room, they had to be in their car outside. There were a real limited number of people in the food shelf. Masks were worn, gloves and all that kind of thing that goes with the pandemic. And in between clients, carts were washed, And the other thing that we did, just a change in style of shopping. Under normal conditions, a client would reach into a refrigerator or freezer or off the shelf and choose what they wanted themselves. The shopper with the client would help them bag it. When this hit, we just changed to the client saying, pointing, I want that, I'd like that, I'd like that. And our volunteers who were in gloves and masks and doing hand washing would pick it out and pack it for them. So they had a little more standoffish experience. And since things have lifted, we've pretty much gone back to a total client choice. When FOODRx patients come in, their box is ready. Who's ever working the desk that night has the records there, and they can, get which boxes specifically for them. And we've encouraged them, begged them sometimes to step into the food shelf and kind of gaze around and see what we've got, and encourage them to then additionally shop, because we have an amazing food rescue program and we have produce, eggs, milk, fresh vegetables, apples, you name it. We always seem to have a good supply of that. So that's how it works. And for a food shelf that say, well, this is going to be a lot more work, with the assistance of our person, Sarah Denzer, and the program in general, it's not that much work. It's just another opportunity to feed people.
That's excellent. Excellent. Well, thank you, Fred. And we definitely appreciate your teams. We value you, and we definitely appreciate all the work that you guys do for your community and partnering with FOODRx as well. So more to come for that. But moving on to some of our other questions, this will be for anybody that would like to answer. Our FOODRx boxes offer culturally connected meals and recipe cards, and they're translated in Spanish and Somali. And why is it important to tailor food we provide to specific communities?
Since I was just on, I'll say one thing, so they'll eat it.
Great answer.
I can follow that up just from the North Memorial Health Clinic system perspective. We have such a significantly large footprint across the Twin Cities metro area, serving close to 55,000 customers each month. And so with that strong presence, we serve a very diverse set of individuals who come in to see us. And so this variety allows us to provide a solution that works for all of our different customers. Food and helping people isn't a one-size-fit-all solution. The different communities have different dietary preferences, and some people have different dietary restrictions. So it's important for us as a healthcare provider to ensure customers have access that fits their nutrition and culturally religious needs. The FOODRx program allows us to meet people where they're at and allows us to cater to those individuals.
Yes, excellent. And to piggyback that, meeting patients where they're at, FOODRx doesn't just provide the medically tailored food boxes, but we also educate patients on their diabetes and their cardiovascular diseases, and also how to prepare these meals. So why does that education component matter?
I suppose I can jump right in again. So over the 6-month enrollment that we have for individuals enrolled in the FOODRx program, we think it's really important that those customers gain confidence to take control of their health. Like you said, understanding any sort of chronic conditions they might have, but then also understanding how they can sustain healthy eating and a healthy lifestyle. So we think teaching those customers how to prepare those healthy meals can help build that confidence. It shows how easy it can be to integrate healthy eating into their lives. It doesn't have to be a 5-star Michelin rated meal, but it can be something very simple. Over the course of the FOODRx program, we've received some feedback from customers and their experience trying new foods. One in particular, and I'll read this quote, they said, lentils are not something I've eaten a lot in the past. They've not been in my diet much, but I did make some lentil soup that turned out really well. And so I think something as simple as that, and integrating something as healthy and simple as lentils into your diet, I think is a huge success. My hope is that individual, now when they go to the store, they're not scared to try cooking new foods. They're not scared to integrate lentils into their daily diet. And so overall, that confidence works wonders to help customers sustain those healthy habits. And I think on the other side of it too, if it's an adult who's preparing food for a family, I think it's easy to engage your children into that cooking as well, which then in turn helps them maintain a lifetime of healthy eating as well.
Yes, excellent. Thank you so much, Michael. At Second Harvest Heartland, we talk often about the twin crises. The pandemic we've all lived through this last year and elevated rates of hunger that too many of our neighbors have faced. How have the disparate health and economic effects of COVID experienced by communities of color presented in your work? Again, this could be for anybody that would like to answer.
For me, I found that some patients, it was hard for them to get food because they were scared of COVID. They didn't want to go to the grocery store to get food. So that kind of impacted it too, just being scared to go out of the home in general. And there was a client that I was working with that I had called for the FOODRx program who didn't even want to come get a box because he said he wanted to wait till COVID was over. So I think COVID does played a lot of how people ate and stayed healthy as far as food goes.
In Wright County, which is just west of the metro area, one of the interesting things that happened was the Wright County Community Action Group started pressing on a frozen heat-to-eat meals for seniors, and with delivery to the home. And that really took off, especially in what we call out here the Highway 12 corridor, which includes towns like Cokato, Montrose, Delano. They ended up serving a lot of people in that situation where they just weren't, seniors who just weren't going to come out. Yep. And at the food shelf, our food shelf, what we saw related to that was a drop in the number of seniors that we were seeing.
Yes, it definitely plays a big role in how to get the food that you used to get during the pandemic, especially. Excellent. Thank you both. So what's the next step for strengthening the connection between healthcare and food? What would you like to see happen or change in the next year?
I'm ready to go. This is Fred Naaktgeboren. One of the things, a couple years ago, my doctor told me, you're a diabetic now. And that was an interesting revelation, although I'd been floating on the edge of it. And one of the things that happened with that, of course, was we went to the diabetic class to learn how to eat better. And that, for me, was helpful, and for my wife, it was helpful. But just curiosity to my fellow panelists, could this connection be made stronger for people that we want in this program if there was an ability for them to meet with a nutritionist? My wife and I did that also, and that was helpful in the sense that you learn some of the foods you really love, you should probably not eat so much of.
Yes, Fred, I'm always game for meeting the dietitian. Just saying, I'm not biased or anything, but just saying that the registered dietitians are a big play into helping you manage your diabetes and chronic disease for sure. Excellent. Well, thank you everybody for questions. I know that there have been some questions in the chat that can be answered.
Absolutely. So the questions are popping. Thanks so much to the audience for sending them in. First one is actually for Fred. Fred, I don't know if you're able to turn your camera back on, but we would love to see you if possible. I don't know if you're having a tech issue there. But the first question coming in is for you. Joanna in Bloomington is curious what you think can be done to defy the stigma around asking for food assistance that you mentioned earlier on in the call. Okay, it sounds like maybe Fred can't quite connect. Maybe it's having some tech issues there. I'll just kick that to the rest of the panel. What do you say to folks who are hesitant to ask for grocery help when they need it?
That's a tough question. I think there's a lot of other aspects that contribute to it. Two of the things that we've run into with the FOODRx program, especially during COVID, one was just engagement and maintaining enrollment in the program. And the other was transportation issues. And so I know sometimes it's tough to ask for help, but those are two very real pieces that contribute to it. Overall, I think, like you said, we need to reduce the stigma because everyone needs help sometimes. And I think as a community, we're here to work with each other and help lift each other up. A rising tide raises all ships. And so if we can make it easier to access these types of resources and make it truly a community, an event and a community effort, I think it just instills more confidence and that security in individuals.
That's great. Yes, I'd love to hear that. All right, so here is a question coming in for Jana. Do you partner with just healthcare providers? What about insurance companies? This question is coming from John in Richfield.
It's a great question, John. Thank you for submitting that. Yes, we partner with health plans around the state of Minnesota. So FOODRx is currently contracted with 4 of the largest health plans in the state right now. So thank you for that.
Excellent. And one more that I think maybe a couple of folks on the panel could weigh in. Do FOODRx partner clinics provide other nutrition support, like connecting people with food shelves or SNAP, or is it just the food boxes? And this one is coming from Katie in Minneapolis. Jana, maybe we'll start with you.
Sure. Thank you, Katie. Great question. These are awesome questions, by the way. Yes, so FOODRx provides additional resources. So we partner and collaborate really, really closely with the SNAP team and Child Hunger team and any team that wants to partner with me, which is the secret sauce and the beauty about being part of Second Harvest Heartland and being underneath that hunger relief organization, because we're able to utilize all of the amenities that the food bank offers. So we partner with them. So we set up the patients if they are interested in SNAP or they need additional help filling out the applications with a SNAP specialist who connects that patient or connects it with that patient and keeps that patient until they're done with the application. And the really cool part is that when the patient's up for renewal, the SNAP specialist reaches back out to that individual and offers help if they need to be able to renew their SNAP. So there's no lapse in coverage. The other piece that FOODRx helps with the patient is offering additional resources. So we offer and help the patients with food resources, whether that's local food shelves, local produce drops, and non-food resources. So if they're having struggles with some of the other social determinants of health barriers, such as housing, utilities, free tax help, which has been hot lately. And so we're able to connect them and keep them well-rounded and really keeping them the center, that patient or that member, the center of the care. So they're able to have this closed loop care for them. And so they're taken care of even after the FOODRx program is done. So thank you for the question.
Yeah, that's fantastic. And now maybe one for each of the panelists, maybe starting with Rose. What's something that surprised you about FOODRx or that you think everybody listening should know about the FOODRx program and Hunger and Health?
Hi. I did want to piggyback off of the other question as
Oh,
far
yeah,
as
please do.
the barriers to, as Michael was mentioning, transportation. We do have the ability for clients who have transportation barriers that we can call them a lift. The lift it'll be no charge to them. Lyft would pick them up from their home, take them to the destination once they've gotten their food box, and they can call me, and then I would arrange for a Lyft to take them back home. Now, can you repeat the question again?
Yeah, so that's great, Rose. There's a whole kind of network of support, it sounds like. It's amazing. So the new question was, is there anything we haven't touched on that you think we should say about FOODRx? Just something that might surprise folks, or that you think they should know. And I'll open that up to Michael and Jana and Fred as well. But we'll start with you, Rose.
Yeah, I just think people should know that the boxes do contain a lot of healthy items, and I know there's some clients who originally didn't want it because it didn't contain fresh produce, but I explained to them, it got recipe cards in there. You can make this, you can make that, and they're like, "Oh, really?" I'm like, "Yeah." So then they're like, "Oh, okay, yeah." So you can still have healthy food without it being fresh produce.
Right. Absolutely. That is something that Jana tells me a lot. All right, Michael, anything you want to add?
I would just say the flexibility of the program, and frankly, the team that we work with over at Second Harvest as well, like we touched on earlier, there's a number of different boxes which vary by cultural need or cultural preference or religious need or religious preference. So just the ability to have the different types of foods in the box is incredibly helpful when engaging individuals. Additionally, when we do screen for food insecurity, we have a significant number of individuals who screen positive, but a handful of them don't want to enroll in the FOODRx program. Fortunately, though, the FOODRx team has other resources. They have those SNAP resources. They have those food shelves identified. And so it's that ability to, again, meet individuals where they are at and give them resources to help get them through times of need or struggles, but not forcing them to enroll in a program that they just may not be ready for at this time. So it's just that overall flexibility and the ability to change. When COVID hit, we had to figure out a new strategy to get boxes to individuals. So just the overall flexibility of the program, I think, has been monumental and incredibly impactful from our point of view.
Yeah, that's great. Nimble in good times and extra nimble last year. All right, Jana, how about you?
Oh, I'll try not to get on my food pedestal. But to piggyback what Rose said, I preach that no food is bad food. Canned food is not bad food. And so we really try to hone in that food is medicine. So we really want to start there first, and how these prescription boxes are going to help manage their disease. So yes, they may be food insecure, or they may be struggling in some other area of the social determinants of health areas. But ultimately, what the boxes do is it helps bridge that gap between their hunger and their health. And it actually does help them manage their blood sugars, their hypertension. The main feedback that we usually get is weight loss. So they have this massive weight loss because of portion control. So we all have portion distortion, right? So when they start losing a bunch of weight, that also takes down then the blood pressure, decreases the blood sugars, and it all kind of falls into place for them. So we really try to hone in that the food box is not necessarily to provide you with food, although it does that. The other 50% of that box is to help manage your disease. And we really want to be able to give you a long, healthy, sustainable life on top of that. So that's my preach for the day.
That's fantastic. So it's gone fast. We are already out of minutes together, but it was such a pleasure. Thank you all for the fantastic conversation. Thanks to our panelists. Thanks to folks who attended. It was really a great conversation, and we'll see you next time.